I'm Von Biggs, and let's queer up health. New ADAP limits could strip HIV treatment from thousands of Floridians. Tonight we bring you a breaking news that will directly affect tens of thousands of people living with HIV across Florida. Florida ADAP, the AIDS Drug Assistance Program, has announced abrupt and sweeping changes to eligibility, medication access, and funding that will fundamentally reshape HIV care across the state. These changes take effect March 1st, 2026, leaving consumers with just 2 months to find alternative coverage. Here is what you need to know. First, direct access to ADAP-provided HIV medications will be limited to individuals at or below 130% of the federal poverty level, the sharp drop from the current eligibility limit of 400%. For 2026, that means just over $20,000 for a single person and roughly $27,000 for a household of 2. Anyone earning even $1 more over the cutoff will lose ADAP-provided HIV medication coverage, regardless of clinical need. Second, ADAP will continue covering medication copays for insured clients up to 400% for the federal poverty level, but ADAP-funded insurance premiums will be eliminated. Consumers who relied on that support will now face full costs of coverage, and many may lose insurance entirely, along with access to providers, lab work, and ongoing care. Third, ADAP is moving away from certain single-tablet antiretroviral regimens. Biktarvy will be removed from the formulary, and Descovy will be restricted to individuals with documented renal insufficiency, with the state signaling that further changes may be followed. Fourth, the ADAP rebate model will be eliminated, reducing funding for staffing and critical operations statewide. According to the National Alliance of State and Territorial AIDS Directors, Florida ADAP served over 32,000 clients in 2024. Roughly half of all clients earn between 138 and 400% of the federal poverty level and are now at immediate risk of treatment disruption. This is not a simple policy change. It is a life-altering disruption that threatens viral suppression, public health progress, and the stability of thousands of working Floridians who depend on uninterrupted HIV treatment. Look, first I need to say this. We all know I work for Holy Cross. This has no way, I can't speak on behalf of Holy Cross on this, as well as I am the vice chair for the HIV Planning Council, but I'm not authorized to speak on behalf of them either. So I speak as the advocate, the person that I have worked with HIV for 10 years, and speaking to that in the community that I have served, for many years living here in South Florida. It's heartbreaking. We learned of this starting Thursday. ACA insurance cuts off effective tomorrow. We fought for 3 months to get everybody enrolled in ACA insurance, and now they're going to be receiving letters in the mail saying that their insurance coverage, if they fall above 130%, will be discontinued for non-payment, which means you don't have a life-altering issue to find new insurance. It leaves them in the lurch, so to speak. It's disheartening. Majority of the people on Ryan White are using Biktarvy, and with that going away, they will go back to a generic 2-drug regimen. Now, I do know, and I've talked to a lot of experts, there's nothing wrong with the 2-drug regimen as far as its effectiveness, right, for treating HIV. But we do talk about, pill burden. We talk about things like that where people don't want to take multiple pills. Yeah. But unfortunately, if you're going to get assistance and funding that will cover it, that's the way we're going to have to go about it. There were meetings going on today that we still don't know what the result was, where they're talking to all the funders here in Broward County. We had people up at the state. There are some videos that you can see online from the state house meetings today talking about it, people complaining about this, that how can the state, who this program was 100% fully funded based on rebates alone, so they didn't have to put any money out to cover this, and now they're saying we're going to keep the $120 million plus, and we're not going to cover this. So there's still more news to come, a lot of news to come. Yeah. But I'm going to tell anybody out there, if you are on Ryan White and you take Biktarvy, please get to your doctor and get a 90-day prescription right away, because you need that, because we don't know how long this is going to last. And do everything you can to get those drugs taken care of. I always think that, we'll have to call in our federal health qualified facilities, our FQHCs, because that's kind of what they were put on the, in our country to do, to handle situations like this. But people, if they stop taking medications, we're looking at not maintaining our viral suppression, and that could set us back to the 90s.
That's just scary. It's scary up and down, and there's no one more equipped to bring us this story than you. So first of all, thank you so much for what you do, because you bring it to us with thought, but with heart. You understand? And when you started reading all this, I was looking at Trini like, too many numbers. Wait a minute. Like, you know what I mean? How does someone that right now is living and thriving with HIV, and is used to getting their medication every month, you're telling them to get 3 months worth, right? What happens after those 3 months? Like, what should be their biggest? I'm freaked out, and I'm not on these meds. You know what I mean? So I'm freaked out for my friends. You know what I mean? And everybody is on those meds that you mentioned.
We're talking, roughly, the way I saw the numbers, it says a little higher in the report, but I'm thinking it's around 9,000 clients, specifically in Ryan White, that this could have a major impact in. Especially if these clients who might have had the opportunity to have employee-sponsored health insurance plans and didn't take them, because ACA ends tomorrow, there's no recourse for them to go back and now enroll for those.
That deadline is over.
It's over.
They can't.
I can't believe we're going back to this.
To the 80s, we're to the 90s.
Right.
Where are we right now?
In the 90s, I worked with Care Resource. I worked with Community AIDS Research Initiative of South Florida, and then became Health Crisis Network, became Care Resource. We treated patients back when the, antiretrovirals were coming out. So they had to take these drugs independently, many of them, and many of them were intolerable. Norvir was one of those that we currently use in many combinations. Some of them are very hard to take. And then the number of pills that you have to take to now, because they're not combined into one pill, now you have to take them separately. This will impact compliancy, and then with that you develop resistance. When you don't take your drug and you don't maintain the level of the therapeutic level in your blood, you will become resistant. And then those drugs that are as good as they are will not be working in the future. You're going to have to find new drugs. The impact that this has is massive. I can't believe that we're going back to this in a country when the president of the country is trying to build a new ballroom in the White House for just parties, and then we are dealing with this in the state of Florida. It's beyond. It's cruel. It's so inhumane. They couldn't stop with just USAID that they, cut supplies to the rest of the world. They had to do it to the people here.
But we knew it was coming. We knew something like this was coming. It's just, it's still like you're still in disbelief, even with it happening,
And we're first. So Florida is first. They're already saying this is going to happen in Indiana. This is going to happen in Texas. It's going to happen in Louisiana. It's
a targeted event. I was just trying to crunch some numbers a little bit. So they said $20,000 for a single male, right?
And $27 per household.
That is $384 a week. So if you make $1 more than $384, now I remember doing some research on the ACA when they were cutting the subsidies for that. So I looked into what Medicaid was, and I believe that they cut Medicaid from single men. Like you had to have a family and have kids in the household. So if you are below this poverty, let's just say, you make less than $20,000 a year. All right, so maybe you get some ADAP, but now you don't qualify for Medicaid either, and you can't pay for health insurance.
And so mind you, you're living on the street because you can't live with that.
Exactly. So it's like by cutting it down there, you're effectively saying we're just cutting it completely. Because, so it's like a targeted anti-gay, if you are HIV, like they're trying, to kill you. They're trying to get rid of us.
But what's even
completely get rid of us.
And you make such a valid point. But what's even scarier with that, Trini, is that Black and brown women, most are straight, are the #1 most exposed from HIV.
And the state
not gay.
And
Okay, they're also
and the state of Florida is number one.
And the state of Florida, Miami's number one.
Right.
I think what you said that really, stayed with me was the fact that we're going back to the 90s. And again, I'm not even old enough to live through it, but I have multiple friends who went through it, whose partners died in their arms. And for me, the mental, just let that sink in for a second, and just think about, the suffering and the fact that we're potentially going back to that.
Yep.
And then the mental stress that this pause on people living with HIV, like they don't have enough to deal with. They have to, from now on, deal on top of that with all of this. It just really breaks my heart to see this happening.
So you deal with that, and then now add housing to it.
Yes.
Yeah.
Add
food.
At that level of
SNAP is
income.
gone.
Yeah.
No, HIV transmission. I mean, poor women that get pregnant and transmit the HIV to their baby because they couldn't get treated.
Yeah.
I mean, we're talking about so many. It's not just gay people.
Right.
This is everybody.
This is everybody.
Like right
This
now.
is everybody that's not white.
That's not
Okay.
wealthy, right?
And mind you, I also want to make a point that, everything that Dino is saying, Dino is a doctor in his country, so he's not just also talking out his ass.
Right.
You know what I mean? He knows what he's saying.
Yeah, no, and I treated so many patients, and many of them made it, but some of them didn't. They couldn't tolerate these drugs.
tolerate it.
The drugs were not working for them. They became, they couldn't. It couldn't work, and these were drugs that are so. It changed so much when they combined it. These cocktails were so difficult, and you had to have the money to have all these pills. They were like 20-some pills sometimes that people had to take.
Yeah.
You can't do, when now you take one pill that combines all this. It's just so, we were doing so well. We're going back so many years. It's so cruel and so inhumane. It's just,
I mean, maybe we can fight. I mean, we need to talk to our legislators about this. We need to vote. We need to write.
Right.
It's our Florida government that's doing this, that's starting it. If we can find a way to put a stop to this, maybe it'll help the other states from doing the same thing.
Right.
Make your voice heard.
Make your voice heard.
Yes.
There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.